Welcome to Las Vegas as it's HIMSS 2018 as we get to know some of our CommonWell Alliance members. And Scott Adams here with you. Time now to focus our attention on Kno2 and their Director of Interoperability, Alan Swenson. As Alan, what's Kno2's area of expertise when it comes to nationwide interoperability?
Yeah, Kno2 is all about interoperability. We provide interoperability as a service, allowing providers to connect to multiple methods of exchange, all in one single location, including cloud faxing, direct messaging, referral networks, and obviously query-based record exchange through CommonWell, as well as other exchange frameworks such as Carry Quality and various HIEs that we connect through. Our goal is ultimately to remove fax from healthcare. However, fax is still a large part of how information is exchanged in healthcare today. So while it may seem counterintuitive, that's actually where we start, is with fax. We're then able to use our custom connectivity assessments and analytics of fax volumes to tell users, hey, did you know that hospital you receive tons of faxes from uses Cerner and they're part of CommonWell? You could query them for records rather than asking them to fax records to you. Or hey, did you know that provider that you send lots of referrals to, faxes, uses Athena Health, and you could send to their direct address instead of sending them fax. Providers can then easily move to sending, pushing out a direct message or sending a query, those more interoperable types of exchange, without having to really change anything in the workflow they've already been using through Kno2 for sending and receiving faxes. And since it's all integrated in our system, the long-term contribution is ultimately that we're going to enable everyone to throw away our fax machines. I hope that someday we'll hear two providers sitting around in the office talking about the old days, and one of them...
Unusable hardware, right?
Yeah, one of them will search online and pull up a fax machine sound. Do you remember when we used to have to listen to this sound for minutes on end, waiting for records to be sent over? And the new guy in the office looks over and says, what is that sound? Right? He's never heard a fax machine before. Why would he? We don't use fax in healthcare. That's the goal. Kno2 is opening the path to interoperability for everyone and using fax for now in order to eliminate fax entirely.
So what excites Kno2? What excites Alan Swenson in the next 5-10 years when it comes to advancing interoperability in the healthcare industry?
Well, I really hope that 10 years from now we're not still talking about how we're going to solve interoperability. Hopefully not in 5. We're at the point today where providers are beginning to see interoperability as an expectation rather than as an exception. However, much of interoperability today is based on meaningful use programs that were aimed at acute and ambulatory providers and largely ignored the rest of the care continuum. Now, Kno2 does work with some very large health systems who use some of the big name EHRs, but still have interoperability gaps that we help them to close. But we're most known, or at least most often associated, with providers who did not receive that government incentive for moving to EMR systems. And thus they were left behind in that transition to the more interoperable types of exchange, such as skilled nursing and long-term care, post-acute care. We cover about 70% of EMS and are working with behavioral health, dental, vision, etc. The goal is to enable interoperability for everyone so that when that large hospital across town needs to discharge a patient to a SNF, they don't have to fax everything over. They can just send a direct message like they would to any of their other large trading partners. Or when a patient is picked up by an ambulance, the paramedics can do a query while en route to the hospital to pull in patients' medications and allergies and be able to provide the best care to the patient during transport, and then push a summary of the information they did into the hospital's emergency room EMR system via a direct message. I think that over the next several years, we're going to see, addition beyond just that basic direct messaging and query for records, full closed-loop interoperable referrals, interoperable SNF placement during hospital discharge, care coordinators having all of the information that they need. I think that over the next 5-10 years, especially looking that far out, interoperability is going to see some huge leaps forward to the point that hopefully we're not talking about interoperability anymore. It's just the way that it happens. The provider who needs information about a patient has it in an easily usable format at the time they need. And it doesn't matter whether some of that originated locally or at a specialist across town or while the patient was on vacation across the country. It's the patient's single unified medical record seamlessly exchanged and following the patient. And that doesn't even get into consumer access, where I think we'll see some big things in the next several years, with patients having immediate access and really owning their own clinical information.
Which I think leads us to as to why Kno2 was so happy to want to get aboard with CommonWell's vision, right?
Yeah, I mean, definitely. That's definitely a part of it. You know, we work with providers throughout the care continuum, with patients as well, PHR systems, and ultimately, you know, we look at all of the ways that information needs to be exchanged and aggregate those exchange methods into a single solution. The faxing, direct messaging, query for records, referral networks, make it so that providers and even patients can have access to all of that information in one place. Now, CommonWell provides a network that covers a huge portion of acute and ambulatory providers across the country, and Kno2 brings to that the long-term care and the skilled nursing, the behavioral health, vision, dental, EMS that were traditionally hard to reach markets. CommonWell connectivity through Kno2 allows our providers to easily exchange information with those acute and ambulatory providers who also care for their patients, as well as access a multitude of other CommonWell services such as PHR systems, consumer access apps, payers, life insurance agencies, and others who would otherwise be relying on fax today.
Alan Swenson of Kno2, one of our proud members of the CommonWell Alliance. And for more information on them, you can log on to CommonWellHealthAlliance.org. Thanks so much, Alan.
Thank you.